I wanted to start by just asking you about your reflections on the care that you received. I know you've spoken about it before, and I watched that really very moving video you did for Prostate Cancer UK, explaining your journey and how difficult it was. So if you could say a bit more about the care and the interactions you had with the clinical staff.
Of course, everyone is very different when it comes to medical treatment, especially something as serious as a cancer diagnosis and treatment. Some people dive into the internet and want to master all the facts and become obsessed with alternative treatments and so on. And obviously, doctors and medical professionals have to deal with that and as best they can. Others are just almost uninterested, just say, do whatever you need to do, doctor. What I noticed most particularly was that it was already very much in the system of the team that was assigned to me, that explanations and reassurances and just time to talk was very much factored in. It was as much a part of the treatment, really, as any drugs or any procedures that went on.
You talked about being given choices and choosing at the beginning of your journey a certain path, but maybe having to change later on. So how were those choices explained to you, and how did you feel about having to make them?
I was, absolutely given a choice, but it was unquestionably weighted towards the idea of a prostatectomy because of the aggression and the sense that, one of the advantages of that operation is that it gives the surgeon the chance to look at the lymph nodes and various other neighboring bits that might or might not have been caught in a PET scan to have the presence of some of those, and that's that, and to do a biopsy in real time. So while you're still inside, you can take a bit and biopsy bits of tissue and so on. The point was I was given a choice, and I chose the prostatectomy because I felt convinced that this was clearly something that was serious enough to have to be dealt with in that manner. I think patients should be aware, and so should clinicians, that it's really important for the patient to ask questions, so that when a line of treatment, or whether it be drugs or a procedure of some kind, invasive or otherwise, to ask questions and not be afraid to sound fearful sometimes and say, so what is the worst case scenario of this cyber knife you're talking about, for example, you might say? Or what is the worst outcome of this hormone treatment you're suggesting? Well, mood swings, hot flushes, just general sadness, reduction of libido. Some people get it very badly, like a menopause, and some people don't, But the more that is, made available and without obviously panicking a patient, but you should know the worst as well as the best. The best outcome is we think we've got you. We think you're going to be fine, but we do need to deal with this with your permission, and we need to, attack it together and be aware of what the risks might be and balance them out, and have time to think about it. Go for a walk, read this, and come back to me if you've got any other questions. A lot of prostate sufferers, especially those who've obviously had a prostatectomy, will know that libido can be compromised, and obviously ejaculation is no longer a possibility, and therefore a whole part of one's life. And indeed, for some men, almost their identity, their sense of self is deeply compromised by this new way of having to deal with one's masculinity. So there's that, the indignity, the embarrassment, the sense of having come to the end of one's useful life, almost, is something that a lot of men I've spoken to, a lot of men feel when they get this diagnosis. I think I probably was a little optimistic about how I thought and then I'll have it taken out and then that'll be fine. Everything will be normal. And I think it's worth realizing that unless you're extremely lucky, a diagnosis of prostate cancer is almost like a diagnosis of, say, asthma or diabetes. In other words, it's a chronic thing. It's going to be with you in some form, even without the prostate itself. There's a chance and a likelihood that there'll be a few cells. You just have to keep on top of things, and there'll be little follow-up treatments of this, that, urethrotomies, or a cyberknife treatment of a little rogue metastasis, or there'll be all kinds of possibilities. That means that this thing has not gone away. So maybe don't be too optimistic at the beginning that it will be one short, sharp treatment and it'll all be gone. Just it is, to use that tiresome word, a journey, possibly for the rest of your life, just being aware that you're going to need the PSA count to be made every 6 months or so, maybe even every 4 months, every quarter or third, that is, and so on. I think that's an important thing. Just manage your expectations, and clinicians help manage your patients' expectations too. Any ways people can find people who work within the structure of hospitals and departments, any way they can find to use technology to help patients find out more about things, and so that there isn't this tension about, I don't want to bother the doctor, or the doctor feeling bothered, and so on. So it's all these kinds of things. And the best hospitals do have wonderful multidisciplinary teams who get together and who think very hard about what the patient might be thinking at this time. I do think these things are attainable, and I particularly think if hospitals and departments have young, clever, they don't have to be young, but smart people who can find ways of harnessing technology so that more answers are available to more patients without, having to cause more backlogs of waiting lists and so on. And that, to me, is the crucial thing. Do join a patient group as well if you feel that would be helpful, because you'll get tremendous support, and you may find that some of the feelings you have, which might be quite deep and embarrassing, because this is, it's a downstairs issue, the prostate, there's no question about that. So it involves all the downstairs issues that humans are prey to, which for some reason as a species we have, hang-ups about. So, you may find that some of the things you're worrying about are more common than you might have thought, and that others have found a way of negotiating and navigating the problems which may be helpful to you. The way medicine now involves multidisciplinary teams who come together, and that there's a much greater understanding of eye contact, friendly conversation, and openness, and a kind of almost pastoral care of the patient. This has a clinical benefit as well as just being good, decent human manners. And the old days of, Dr. Lancelot Spratt booming about blood in those Doctor in the House movies is rather gone.